I am pleased now to introduce Dr. Craig Vanderwagen, who is, again, a member of our committee and a member of East-West Protection, and he is going to moderate Session 4, which is current capabilities in assessing and using mortality morbidity data during now the inter-disaster period. So to complement the discussion we just had.
Yes,
So,
I think all the panels are actually working out very nicely to be complementary. And we hope to finish strong here. I know it's after 3 o'clock in the afternoon, and for those of us that are over 70, it's nap time, but I wanted to make one comment about, the last conversation, and that is we were talking about patient information or information useful to the command folks in an operations center. And it's pretty much all public entities at the table. And in fact, so much of the business in response has to do with hospitals, most of which are private. And so you're trying to figure out how many people they need to move, what's their acuity level, what are the assets you need to move them, where are you going to take them, is the road clear? I mean, in the event of Harvey, everything was flooded. You couldn't move anybody except with rotary wings. So there's a whole set of information flow that we really didn't talk about that doesn't come from the public sector in the event, okay? I mean, after the event, they're going to capture a lot of that into the public sector, but a lot of it is tied up in the private sector while you're in the fight. So I just wanted to make that point, and we'll have to think about that as a committee. What does that mean, if anything? I'm very pleased with the panel that we have here today. We've got a couple of folks who have responsibility for health planning, for preparedness and response at the local level. Local in one case means about 8 million people in 800 square miles. The other local is about 800,000, 10% of that people in how many hundreds of thousands of square miles? I don't know what Alaska is, but so we'll have some interesting perspective. And again, remember my comment this morning about urban and rural considerations and what data is useful in that context. We also have a veteran of Katrina with us, part of the family as far as I'm concerned, Jimmy and Roseanne and that crowd in the health department, but they interface with Devin closely, and a lot of lessons were learned in Katrina, and I think Devin's going to speak to that a little bit. Amy comes to us from an academic environment, but she's worked very closely with the New Jersey Department of Health looking at what was the morbidity and mortality in Sandy and what does that mean. And so I think we'll have some very interesting insights from Amy. And lastly, we have Mr. Data, if you will, from CDC, Chesley Richard, who's in a very critical position to align data with scientific understanding of reality and what that means in terms of public health and medical interventions that we may design for disaster response. So a very good panel, range of experience. I think they will be very good in helping us to understand some of these issues.